My name is Praveen Kalra, and today I'll be talking about Your Mess Has a Message for You. I'll try to justify the title for the next 45 minutes, and I'll talk about how and why sustainability is so critical for the delivery of healthcare, how our own actions impact sustainability. We'll talk about some of the sustainability green initiatives we have taken at Stanford and the lessons learned, and where do we go from there. So US spends the highest amount of money on healthcare, almost 18% of its GDP on healthcare, and it contributes to around 10% of greenhouse gas emissions. Now, these greenhouse gas emissions have increased by almost 30% over the last decade or so. Even though we are spending the highest amount of money on healthcare, certain parameters in terms of life expectancy are not significantly better as we compare it with other developed countries. What if I tell you that your zip code is a better predictor of your life expectancy than your genetic code? And we see that classical example in Boston. So there are two suburbs, Back Bay and Roxbury, almost 2.5 miles apart. But one has a life expectancy of around 91 years, other one has 58 years or so. So researchers started collecting data from insurance companies about 45 million people, including 1,000 pairs of twins, for 560 common clinical conditions, and they wanted to evaluate the impact of genes or the environment on the disease. Around 40% of the disease is associated or linked with the genetic component. Another 25% stemmed from sharing living environment. Additionally, another 25% came from the socioeconomic status, and that's where we talk about the zip code. Almost 22 diseases are directly related to the quality of air we breathe. So when I'm talking about sustainability, I'm actually talking about environmental justice. I'm talking about the quality of air we breathe, the food we eat, the water we drink. By the way, this study was not designed to prove that you can blame your genes or the zip code for the disease or so. Now, hospitals are extremely energy resource buildings. Hospitals consume almost twice as electricity as compared to any other commercial buildings of similar size. They consume around 510 gallons of water per bed as compared to any other building of similar size or so. If you have to look at the carbon emissions of one academic center over the course of 1 year, that can be equivalent to burning 190 million pounds of coal each year. If US healthcare sector in itself is a country, it would rank 13th in terms of greenhouse gas emissions. Now, why is it so important from an anesthesiologist point of view? And the answer is around 30% of the waste is generated in the OR. We generate around 4,000 tons of waste per day. 70% of that waste is considered as biohazardous, even though it should not be more than 15% or so. The amount of waste generated in the OR in 1 day is more than what a family of 4 will generate in a week. And simply converting from disposables to reusables, we can reduce our waste by almost 2/3 or so. Now, why is clinical sustainability so important? Because it is central to the value of quality improvement. Anytime you define a value of a product, in our case, healthcare, is equal to mathematically outcomes or experiences divided by the cost. Now, 2/3 of the greenhouse gas emissions comes from procurement, and we make those choices in terms of buying what type of devices we are going to use, drugs, supply. So clinicians actually drive the utilizations of medical goods and so, and they can also influence policies driving building energy use as well. Now, there is no dearth of physicians, people who absolutely are passionate about sustainability, but there is a significant wedge or a divide between thinking about sustainability or taking some meaningful action to address it. So Practice Green Health actually submitted some data about if all the hospitals adopted best OR practices, we can save almost $5 billion in 5 years through energy reduction, waste segregation, reprocessing, and OR kit formulation, and so. In fact, we can save approximately $56,000 per operating room using these strategies and so. So now I'm going to take you through a satellite view about how healthcare emissions are looking, and then we'll delve into your own operating rooms where how your own actions impact sustainability and so. So the total healthcare carbon footprint is almost 4.5% of total global net carbon emissions, which is almost equivalent to 2 gigatons or so. As you can see, United States is the number one healthcare related emissions in the world. In fact, if you compare it on a per capita basis, United States emit 57 times more emissions per capita per person as compared to somebody living in India. But that is actually a skewed way of interpreting these results because US spends 18% of its GDP on healthcare and has one third the size of the population versus India, which only spends 2% of its GDP and has a population of almost 3 times the size of United States or so. When we talk about greenhouse gas emissions, we have to talk about scope 1, 2, and 3 emissions. So scope 1 emissions are coming directly from the healthcare itself or the infrastructure. They contribute around 17% of greenhouse gas emissions. Scope 2 emissions are coming from the energy produced or energy consumed actually, and also from the water used through for air conditioning, for steaming, for chilling purposes. And that constitute around 12% of greenhouse gas emissions. So the majority of the greenhouse gas emissions are actually coming from the supply chain, almost 71%. And that includes your food chain, agricultural stuff, pharmaceutical drugs, medical devices, and so forth. So this is our own footprint. So as I said earlier, United States has almost 8 to 10% of their greenhouse gas emissions. They are spending almost 18% of its GDP. And if in terms of coal-fired plants, the healthcare sector footprint is for US is almost 141 coal-fired plants. Out of the total healthcare emissions are equal to around 514 coal-fired plants. So let's talk a little bit about anesthetic carbon footprints. So as I said earlier, that the total healthcare carbon emissions are 4.5% of the total global net emissions. Out of that 4.5%, 1% is coming from anesthetics. That's a lot of carbon emissions from anesthetics. It's almost equivalent to 4 million metric tons, or basically coming equivalent to almost 1 million cars worth of auto emissions. If you divide it further, 0.6% of them are coming from anesthetic gases, and 0.3% are coming from hydrofluorocarbons, which are typically used in multi-dose inhalers like albuterol. Dividing it down even further, 0.4% are coming from nitrous oxide and 0.2% are coming from other fluorinated inhalational anesthetics. Now, these numbers will change from country to country. Countries where nitrous oxide is used more frequently, like Southern America countries where they don't have the availability of desflurane, majority of their emissions are coming from nitrous oxide. Whereas in United States, majority of the emissions are actually coming from desflurane or so. So let's examine and evaluate the impact of surgery on global climate. I'm going to take you to compare 3 different hospitals in 3 different countries in 2 continents and see how surgery is contributing to carbon emissions. So we are going to calculate the carbon emissions in the operating room over the course of 1 year and so. As you can see, ORs are extremely energy resource intensive buildings. So all these 3 hospitals have very unique properties. They all are tertiary centers. They have more than 800 bed capacities. They have almost similar number of ORs. So on the left is John Radcliffe Hospital in London. And on the middle is University of Minnesota Medical Center in US. And on the right side is Vancouver General Hospital in Canada. But there are some unique differences in these as well. So John Radcliffe Hospital has a very large surgical suite size of around 3,000 meters square. And they did almost 30,000 cases in 1 year versus University of Minnesota Medical Center, which has a smaller surgical suite size of around 1,450 meters squares. And they did the least number of cases, 18,000 cases per year. Vancouver Hospital did around 22,000 cases or so. Now, John Radcliffe Hospital does not use desflurane. So in terms of anesthetic gases related carbon emissions, John Radcliffe Hospital's carbon emissions were the least, 211,000 kilograms of carbon dioxide emissions, versus University of Minnesota Medical Center and Vancouver Hospital, whose carbon emissions due to anesthesia were in a range of 2 million kilograms of carbon dioxide emissions. So think about it. John Radcliffe Hospital did the highest number of cases, 30,000 cases, and had the least carbon footprint of only 211,000 carbon dioxide emissions, almost 1/10 as compared to the other two hospitals. Now, in terms of energy consumption, John Radcliffe Hospital is an old building. It does not have very efficient HVAC systems. So in terms of energy consumptions, John Radcliffe Hospital actually has the highest energy consumption of almost 10,000 megawatt hours per year, as compared to the other two hospitals whose energy consumption was roughly around 4,000 megawatt hours. So if you look at the carbon dioxide emissions coming from consumption of energy, the highest carbon footprint was actually that of John Radcliffe Hospital. Now, if you add these numbers, so John Radcliffe Hospital, least emissions due to anesthetics, highest emissions due to inefficient HVAC systems. So the cumulative total number was the highest of 5.1 million kilograms of carbon dioxide emissions. And Vancouver General Hospital actually has the best portfolio in spite of spending 2 million kilogram carbon dioxide emissions coming due to anesthetics. Almost total number was around 3.2 million carbon dioxide emissions. So on the left-hand side, A is actually your Vancouver General Hospital. In terms of per case basis, 63% of emissions came from anesthetic at Vancouver Hospital, and only 17% came from energy use. So per case, carbon dioxide emissions were the lowest, almost 146 kilograms. On the right is John Radcliffe Hospital, where 84% of the emissions came from inefficient HVAC systems, and only 4% came from anesthetics. So their per case basis numbers were roughly around 173 kilograms of carbon dioxide emissions per case. And here's US, highest, 232 kilograms of carbon dioxide emissions, 51% coming from anesthetic use or anesthetic emissions, and 36% coming from inefficient energy operations. We all make decisions every day in terms of sustainability. And let's look at an example of how an administrator impacts these decisions. And so in terms of blue wrap, an administrator can make a decision whether they want to still use the practice of having blue wrap, or they can invest in buying these metallic surgical cases. Clinicians make these decisions like us, in terms of whether we are going to use disposable devices, pharmaceutical wastage, so we can address sustainability there. Manufacturer can also address this issue by selecting friendly materials which are friendly to the environment. So I'm going to take you into the operating room, and let's look at how different surgical approaches impact sustainability. And the classical example we are choosing is hysterectomy, because that is one of the procedure which is extremely commonly done in the operating rooms, and it has done through 4 surgical approaches: abdominal, vaginal, laparoscopic, and robotic procedures. So Dr. Cassandra Hill actually did a life cycle analysis of 60 hysterectomies, 15 in each categories, and they basically ran the waste audit to see how each surgical approach contribute to the waste generation. So they basically did a waste audit of medical solid waste, regulated medical waste. They also did the amount of anesthetic gases used, transportation of the waste, as well as paper and cotton waste as well. So this is what they found after they opened up each trash bag after the surgery is done in the operating room. So this is all single-use equipment that was thrown in that. You can look at the number of batteries that were used in robotic surgeries or laparoscopic procedures after single use. Single-use disposable stainless steel devices, e-waste. So robotic surgeries on an average fared worst. They generated almost 30% more waste as compared to any other approach, almost 13.2 kilograms of waste per case. On the other hand, abdominal and other vaginal procedures generated around 9.7 kilograms of waste per case. If you quantify that waste, 50% of that waste came from plastic. Additionally, another 22% came from gowns, blue drapes, so on and so forth. 18% of the waste came from paper, and only 5% of the waste came from cotton. So in terms of, if you look at vaginal cases, very less plastic is used. So their cotton waste contribution was roughly around 10% or so. Now, there was no standardization in terms of providing anesthetic care. It was absolutely left up to the discretion of the anesthesiologist. So in abdominal and vaginal procedures, two-thirds of the greenhouse gas emissions actually came from anesthetics. On the other hand, in laparoscopic and robotic cases, one-third of the greenhouse gas emissions came from anesthetics, and two-thirds of the greenhouse gas emissions came from all these plastic waste that is generated during the case. In almost every category, robotic surgeries fared worst in terms of ozone depletion, smog, eutrophications, greenhouse gas emissions, carcinogenic potentials, and ecotoxicity or so, because they are generating so much of waste. Now let's talk a little bit about anesthetics as well. These are some of the anesthetics that were used during the case. As you can see, the highest greenhouse gas emissions came from using nitrous oxide and desflurane, and the lowest carbon emissions came from using total intravenous anesthetics. So friends, what we do make a huge impact. And if we have to design strategies to reduce our greenhouse gas emissions, we control 36% of the greenhouse gas emissions, simply educating ourselves by eliminating the use of anesthetic gases like desflurane, reducing fresh gas flows, total intravenous anesthetics, or regional anesthetic techniques. We can reduce the greenhouse gas emissions in the operating room by 36%. The second big item would be using minimal instruments, because that will contribute to almost 46% of your greenhouse gas emissions. So better packaging, using minimal devices could be the other way of addressing this problem. Now, also let's look at some of the unused items in the OR. This study was done by Corina Zarkausis, one of our own neurosurgeons at UCSF. They basically did a waste audit of all the unused items across 58 surgical procedures. 38 of them are cranial and 22 spinal. The average cost of unused supplies was roughly around $653, almost equivalent to 13% of your total surgical supply cost. And the three biggest predictors of waste are the case category, case type, and surgeon, and only the surgeon. Duration of the surgery, experience of the surgeon has nothing to do with that. And if you look at the average amount of the waste generated because of unused supplies was roughly around $900 or so, which extrapolated to almost $242,000 per month, or $2.9 million per year. The most commonly wasted thing was typically the unused suture material, sponges or gloves. And the most expensive thing that was wasted was basically the flow seal. So simply, we can do better. We can address it by simply educating the surgeons. We can create surgeon preference card and fairness and transparency in the pricing. Let's also look at the carbon footprint of the cataract surgery, an extremely common surgery done in outpatient setting. So a single cataract surgeries generate around 180 kilograms carbon dioxide equivalent, which is almost equivalent to 1 week of living for the average Brit. If you divide that number of emissions, around 36% emissions are coming from the building or infrastructure, 10% are coming from the travel. Majority of the emissions are coming from procurement, in this case, an intraocular lens. It is so ironic that an intraocular lens, which only weighs less than 1 gram, comes with a booklet of 70 grams. So everything what we are adding up into the package is contributing to greenhouse gas emissions. What if I tell you there is a better way and a different way of providing healthcare? And I'm going to take you to India for that. So Arvind Hospital is in southern India. They do a lot of cataract surgeries, and they have shown and demonstrated that they can make a significant impact on sustainability by cutting back on their waste. So the typical format is they do multiple surgeries in a big hall. So the physical layout is like a big hall. There's a standardization of the process. They reduce waste, they reuse their drapes, they reuse their gowns, and they even use the same pharmaceutical vials on multiple patients as well, while still maintaining safety. They published this paper, which was awarded one of the best papers on sustainability. These are some of their results. They did around almost 300,000 cataract surgeries per year, versus US average is around 3.6 million cases per year. Their intra-op complications rate was around 1.1%. Rate of endophthalmitis was 0.02% or so. So on the left, you see the amount of waste generated after one cataract surgery in US. And on the right, you see the waste generated after 93 surgeries. Look at the stark difference as well. So in terms of auto emissions, if somebody gets cataract surgery in UK, the carbon footprint will be almost equivalent to somebody who drove 500 kilometers, versus in India, their carbon footprint would be almost somebody who drove 25 kilometers or so.